Hello. Today we're going to be doing insulin preparation in the form of use of setting up a Flexpen and how to also give a rapid acting and a long acting, which is also known as a basal. First thing that you would need to do is, if you're doing a validation for preparation for 2210, is we're going to be putting together the Flexpen. The Flexpen is an insulin-based pen. It usually is a rapid acting. But it doesn't matter if it's rapid acting or basal long acting, you still prepare the pen the same way. The most important thing that you need to do about the pen is make sure that the pen is the patient's. You do not share the pen between other patients. It is directly for that specific patient. You must do your 8 rights. First thing you do is you check to make sure that the pen is identified for that patient. Does it have an out date? What's the out date? Here it has an expiration date of 02 of 2027. You make sure that you have the correct insulin that you're using, which is usually a rapid acting, but as I said, you could also have a basal or long acting depending on which insulin you're giving for that day. Now this insulin pen is not a throwaway. It is a multi-use, so you're going to be continuing to use it for the same patient until the duration of the insulin has been depleted in your pen. First thing you want to do is wash your hands. You always wash hands for safety in between. Wash your hands for preparation. Wash your hands anytime you put gloves on, anytime you take gloves off, and you wash your hands when you go to your patient's bedside. So that's a safety issue for our patients. We check our pen. We've already looked at our pen. We know it is exactly the amount we want or what we want to give, and we're going to set this up. You would then take your sterile alcohol wipe and you would clean the edge of this because this is where you're going to be putting the needle. You clean this using a little friction for about 30 seconds. So say we've done 30 seconds. You can throw that alcohol wipe away. The pen needle you're looking at could be 2 different kinds of needle. This is a safety needle because it is made so that it cannot poke you or be reused. When you open this up, be cautioned because there is a needle on the inside. Take that needle and put it into your pen and securely put it on your pen. Do not put it on so tight that you cannot get the needle off when you get ready to return the pen back to the patient's medication box. The next thing you would do is you dial in 2 units because it takes 2 units to clear the air out of the needle so that the patient is getting the correct amount of insulin. And you push the plunger in until it has clicked down. The second thing you do is then you would dial in the amount of insulin you're giving. So say you're going to be giving 2 units of insulin. You would dial it to 2 units. You would think now that this would be the time to take it to the patient's bedside and give them. But before you do that, you must double check it with another nurse. So you would have another nurse who would then look at it, and all she's telling you is, yes, this is the Humalog, Novolog, Lantus that you have, and that it is dialed to 2 units, and it has the patient's name on it. She is not necessarily looking to see if you're going to be giving it to the correct patient because she will not be in the room. But she will look at the patient's chart to make sure that that is the correct patient that you are doing this. What does she ask? She asks, have you cleared the needle with 2 units? Now you've dialed it into the 2 units you're going to be giving. Does it have an expiration date? Is it the correct insulin? She is doing the same safety checks that you just did in preparation for your patient's insulin. She has okayed it and she has signed and documented that it is the correct insulin that you are giving. Now you're going to take this and an alcohol wipe to the patient's bedside. You go to the patient and you, of course, clean your hands. Identify the area that you're going to be giving the insulin in. Your areas can be the deltoid, the back of the deltoid, the sides of the legs, the abdomen, and sometimes the scapula and the back flank of your body. Wherever there is a good fatty area for insulin to be utilized. Now you want to make sure too that when you go to your patient's bedside that you might ask them where would they like it to be given. Sometimes they don't know. You need to check on your chart to make sure that you're not continually giving the insulin in the same spot every time you give it. Because each time you give it, you're going to be accumulating that area and it will cause some kind of tissue breakup or some scar tissue inside. There's a lot of things that can happen. So you want to alternate and move your insulin sites to different areas. Well, we've decided we're going to put it in the abdomen. So you put your gloves on, you go to your patient, and you do your safety checks. Oh, that shouldn't have happened. You do your safety checks. What are your safety checks? You do an identification. Your always list is always what you're going to do. First, you need to have an order. Second, you need to make sure your patient is who your patient is. So you ask them. The identifiers are, what is your patient's name? Ask them. Don't say to them, hi Mary, how are you? They're going to say they're Mary. So what you're going to do is you ask them, what is your name? The second thing you do is ask them what their birth date is. They usually know what their birth date is. Dementia patients don't always, but you're going to use that as an identifier anyways. You have already looked that up in the chart, so you know that. And the third thing is you always ask them if they have any allergies. Most cases, the allergies they know, other times they do not. We're not going to worry about that at this time. So we find our area, we have the right patient, we've done all identifiers, and now we're going to give the insulin. You find the area that you're going to be giving, and you clean that area for about 30 seconds. Not everybody does it 30 seconds on the skin, but according to CDC and also for the teaching method, we usually clean everything for 30 seconds. It is a preparation. You take this cap off, and this cap is a throwaway. You do not have to put the cap back on. You identified your patient, you know what you're giving, you squeeze the area, you take the insulin syringe, and you put it down till you hear a click. Once you hear that click, you stabilize your needle, and you give your injection. You count 1, 2, 3, 4, 5. Then you release. As you can see in the pen, it has released. There is now a red area up here. This places at a safety needle. Therefore, this needle cannot be reused. It cannot cause a sharpness coming off the needle because it has locked into place. You have completed this. In the patient's room, you ask the patient first before you leave the room, how is he doing? Make sure that he's doing all right. Now, what you would do is you would remove this in the sharps if you have a sharps box in the room. Otherwise, you would have to take this out to the patient's medication cart where the sharps box may be. This is okay. It's safety. The needle is not visible. It is not going to harm anyone. You take this out. You undo it. When it undoes from the syringe, you now look, and the other end now has also become a safety. That is thrown into the sharps box. You then would put the cap back on, take your Flexpen, put it in your patient's cart, and then document on your chart that you have given it, where you gave it, and how the patient tolerated it. Make sure that it's the right patient, the right date, the right time, the right medication, the right route, the right interval, the right reason, the right response, and the right documentation. That is your 8 rights. Those are all safety issues. Never take your gloves outside your patient's room, so you would be removing your gloves before you had left the patient's room. If you had done all this, this is the time to remove your gloves. Wash your hands again. Tell the patient you'll be back to see them in about 15 or 20 minutes just to make sure they're doing okay because their blood sugars could drop rapidly. At this point, you have completed doing your validation for use of a Flexpen.